Now to the frequently asked questions. What can patients expect from bracing? The treatment of scoliosis with bracing can be seen as a long-term impairment of quality of life and therefore a great challenge. In order to accept the task of bracing, the patient needs to be informed not only about the realistic goals of treatment, but also about the problems caused by the spinal deformity itself. Provided that the patient makes the decision to begin bracing and then takes responsibility for the treatment, quality bracing treatment will be successful. The purpose of this video is to address the most important issues related to braces. On the one hand, addressing these issues of brace treatment seems to be beneficial for the professionals who regularly treat patients with scoliosis, but it is also necessary because there are so many inappropriate and scientifically unacceptable claims and statements currently being made in the media about brace treatment. We need to minimize the fears of patients and their families when people say, for example, a good brace must be painful. This is categorically untrue, yet it is found in many publications on the internet. Also, questions about the percentage of in-brace correction cannot be reduced to a simple number. This creates uncertainty for patients and their parents. Also, sometimes there is a beneficial outcome with less than 50% in-brace correction. However, a true professional will not be satisfied with a 50% in-brace correction when the curvature easily allows for a much greater amount of correction. Therefore, it seems reasonable to differentiate on this issue and keep patients and their parents on the straight and narrow path to success. The following is a brief list of questions that arise daily in the practice of a conservative scoliosis specialist and the appropriate answers based on scientific evidence. First, is brace treatment painful? A good brace corrects the deformity as much as possible without causing pain. Actual correction can only occur when there is room for corrective movement, not by applying compressive forces which can be painful. Sometimes the corrective effect of compression braces can be satisfactory, but this correction is pointless if the brace cannot be worn because of pain. Of course, with highly corrective CAD/CAM braces, such as the Gensingen brace, patients may experience some discomfort in the first few days because they are not used to the large corrective movement. This discomfort usually disappears in less than 5 days. Second, is an in-brace correction of more than 50% always possible with the highest quality braces? Since in-brace correction depends on many factors, the answer to this question is a resounding no. There are patient-specific factors like curve pattern, patient age, curve stiffness and compliance. Brace and management dependent factors are lack of fit accuracy, built-in compression effects, brace not closed enough on in-brace radiographs. This can also happen. Double or triple curve patterns allow much less correction than single curve patterns. The curve of an 11-year-old girl can be corrected more easily than the curve of a 16-year-old girl with comparable cup angles and comparable curve patterns wearing the same brace model. Here we see a complete correction in a single thoracic curve pattern using a Gensingen brace, which we will call GBW for short. This is from Nikos Tornevitis, Thessaloniki, Greece. Now, a more than 50% correction in a girl with a thoracic curve greater than 45 degrees in a GBW. The patient's 3D scan and computer-aided design brace are shown on the lower right. Here you can see a more than 50% correction in a boy with a thoracic lumbar curve of more than 60 degrees in a GBW. The patient's 3D scan and the computer-aided brace are shown on the right as well. More than 50% correction in a girl with a double curve. After 6 weeks of brace treatment, a slight clinical correction is already visible, as can be seen on the right. Three, do I need a brace for a curve of 20 degrees? This question can only be answered by considering a wider range of facts and information. A 7-year-old child has usually not yet reached puberty and therefore does not need a brace or only nighttime bracing. A 16-year-old girl with 20 degrees usually has no residual growth and does not need further treatment with bracing. We can see this on the growth curve for girls. Between the age of 6 and the onset of puberty, there is generally no significant increase in curvature. Once the first signs of puberty appear, a significant increase in curvature can be expected. Depending on the severity of the curvature, timely treatment with a brace may be necessary in the urgent areas, as an increase in curvature can occur within a few weeks during the early and main growth spurt. T is the Turner stage, M is the onset of menarche. For example, an 11-year-old girl with 20 degrees requires full-time bracing based on current knowledge because she is in the pubertal growth spurt, has a more than 80% risk of progression and is usually easily corrected with an appropriate brace. If a patient is braced early and good in-brace correction can be achieved, there is a real chance of reducing the brace wearing time after 6 to 9 months of full-time treatment. This type of rapid improvement is not as easy to achieve in more mature patients and with larger angles of curvature. During the pubertal growth spurt, curvatures of 15 to 20 degrees can also be braced at least part-time, especially if there is a large deformity compared to the cup angle. For instance, large rotation with only a small lateral deviation. In such a case, the prognosis is poor if no treatment is given. 4. What can be considered a successful outcome of brace treatment? If a curve with a high risk of progression is kept stable within the accepted measurement error, plus minus 5 degrees, until the end of growth, this can be considered a successful brace treatment. For the Boston brace, the success rate seems to be about 70%, and for the old Chanel brace, standard 1999, 80% from advanced center. According to recent publications, the success rate of CAD/CAM Chanel braces from the Genzinger library is over 90%, and in curves between 20 and 40 degrees, final correction of the curve and deformity can be achieved when the brace is worn full-time during residual growth. However, even in relatively mature patients with little residual growth, cosmetic improvements like trunk recompensations can be achieved with modern braces. Such cosmetic improvements significantly reduce the deformity-related stress that the patient may experience, thereby reducing the desire to undergo surgery. In curvatures greater than 40 degrees, significant and stable improvements lasting 5 years after brace weaning appear to be rare. However, in most of these cases, progression can be halted with newer CAD/CAM based Chanel derivatives. Here is a girl with a 38-degree thoracic curvature at baseline, treated with the Chanel light provided by our team from 2005 to 2009, with significant deformity as seen on the surface scan on the left. On the right, the long-term result, 5.6 years after brace removal, with a residual curve of 19 degrees, shows that corrections achieved with the latest generation of braces can be stable in the long term. The latest technology. A Genzinger brace, 3D printed in China. This brace for a double major curve made it possible to fully correct both curves in the in-brace radiograph. 5. How long will I have to wear the brace? The main indication for the brace treatment as a growth channeling treatment is during the different growth phases. During the main growth phase, an unbraced patient can progress 20 to 40 degrees in a few weeks. At the end of the pubertal growth phase, 15 years for girls and 17 years for boys, there is usually no progression of more than 15 degrees in a single year. In a compliant patient with a curvature of less than 30 degrees at the start of treatment, weaning or part-time wear can be started at 14 years in girls and 16 years in boys. If the curvature is greater than 30 degrees at the start of treatment, weaning from the brace should be started later and continued longer to allow for stabilization of the results achieved. Naturally, the curvature will increase to some degree after weaning. This should not be considered a deterioration. Even if you wait a year longer to wean off the brace, the curvature would increase by the same amount. On average, the curve will not return to its initial value as shown in this graph from a recent publication. For more individualized questions, please contact one of our bracing centers.